has been so amazing to be here today to hear all these ideas and possibilities for the future of healthcare. And I want to talk to you today in the category of what if. What if we could improve patient outcomes, be more fulfilled, and have a happier workplace just by bringing more heart to our work? So I've heard a lot of people talk about stress and burnout in the workplace. And a lot of it has to do, it seems, with external pressures from a variety of demands. We have margins, we have budgets, we have scorecards, we have a whole host of targets that we're trying to meet. And these targets are really important. They're how we know where we are in relation to where we want to be. Sometimes, though, when we're trying to reach a goal or move a vision forward, we can confuse the means for the end. We can mistake metrics and measurements for providing good patient care. We can lose sight of the reason that we came to this work in the first place and what it is that we're trying to do. About 5 years ago at the Osher Center, our capacity was not meeting our demand. And so we went to leadership and we asked about the possibility for expanding. I put a business plan together, we submitted it, and they generously agreed to support us in doubling our footprint and expanding our programs and services. So once the build-out was finished, it was really important to me that we meet the targets that we had projected. So every chance I got, I talked to the team about visits and volumes and budgets and margin, because I wanted to make sure that everyone knew what the expectations were. And after a little while, my usually happy, high-functioning team started being cranky and edgy, and there was discord. And it was really important to me to figure out what was going on. And what I realized was our focus had shifted. I had lost sight of the very reason that we wanted to expand in the first place, meeting and responding to patient needs. I was focusing on numbers instead of the patient. I was coming from my head instead of my heart. I think there is a shift that is possible for us now in healthcare. Frederick Laloux, in his book, Reinventing Organizations, describes a Dutch home care company called Burts Ward. Burts Ward's founder considers his role to be holding the vision for his company rather than providing top-down strategy. He opted not to use a traditional hierarchical management model, but went for a horizontal, self-managed, team-based model. Their 8,500 nurses operate in 800 self-managed teams. Compared to other nursing organizations in the Netherlands, their patient outcomes are better, their patients' healthcare utilization is lower, their patient and employee satisfaction scores are better. And Ernst & Young estimated that the Netherlands could save nearly $2 billion a year if all of the home care companies in their country had Burts Ward's results. Scaled to the US population, that looks more like $49 billion. And you know, I think that's phenomenal. That's really amazing. But what struck me and what caught my attention was the change in approach. The horizontal model allowed for every voice to be heard, every voice valued, and for the collective wisdom of each group to emerge. If we're going to move the needle, if we really are going to be creative and innovative and transformative, we're going to need the best of what everyone can offer. And people need to feel valued. They need to know that what they're doing matters and that it has meaning and purpose. Thank you. Google did a study to determine why some of their teams were flourishing while others floundered. And what they found, the single most significant factor was psychological safety. Psychological safety requires that we are authentic and vulnerable and transparent, that we can take risks without fear of judgment or recrimination. It means that we need to bring the best of ourselves moment by moment into every interaction, and that we bring our whole selves, mind, body, and spirit to the work that we're doing. We have to slow down, go within, and make decisions based on what we know is right, rather than reacting to external pressures and circumstances. This is how we connect to what matters. This is how we connect to our values and how we align with our organization's mission and vision. This is heart-centered leadership. I was asked recently, do you want to push more water down the river, or do you want to change the course of the river? We can change the course of the river. We can bring meaningful change to healthcare just by using our heads but following our hearts. Thank you.